So let's talk about warranty work and how can you explain it to patients. Now, for credibility, my name is Khaled. I am a dentist and I have been a dentist for 20 years in Hervey Bay, Queensland, Australia. I own my own practice, Lakeside Dental Spa. I took it from one chair to 10 chairs with a team of 40 of dentist associates, front office, DAs, and hygienists. So if you work in a small practice, you mightn't, and you face this issue, it might be a lot easier to manage because you might work with a solo practice and you just join the practice and if you find any warranty work, so crowns that was done recently and the margins were open or is broken or is chipped and you have to provide warranty work, it might be easier to get the answer on the spot. You can just walk into the principal dentist and they might even take the patient and just fix them themselves. But what if you work in a large practice? And there's a lot of large practices now at the moment. And you see some work from a previous dentist who used to work in the practice or still work in the practice, and this work needs to be redone for some reasons. It's chipped, it's broken, and there is something there that has to be fixed for this patient. And you believe it has to be done under warranty or it needs to be done under warranty, whereas the patient doesn't have to pay for it. A lot of dentists find it really hard and find it very stressful, and it is hard and stressful, I cannot deny that. But I think if you don't have a system in place to manage that, it's going to be even harder. So it's very important that you have a system in place. So if you don't have a system in place, go and ask your manager or your practice owner if it's a large practice, and they need to provide you with a clear system how to manage those patients. And if they don't have a system, be a top associate and create a system with them. Add value to the practice. Hey, let's create a system for myself and all the other associates. I will tell you what should be the easiest way to manage it. Firstly, sometimes you don't know if it's actually warranty work or not. Sometimes you need more time to review the notes and make sure that this work is under warranty. Sometimes maybe the previous dentist has a consent from this patient that this treatment is compromised and the patient agreed to go ahead understanding all the risks and there's a chance of failure, for example. So don't jump into just offering and promising warranty until you check all the records. My advice to you, if you don't have a system in place and you want to create a system, if it's an emergency situation and you're unsure, don't charge the patient. So let's say it's a broken front tooth or a broken front filling. Patient cannot go to work with a broken chipped tooth. And patient is adamant it should be under warranty. It was done recently. The dentist promised it's going to last for years and it's not clear in the notes. You need some time to review it. I would do the minimal work to get them out of the chair happy with no charge. Minimal, nothing would be probably more than $400 or $500. We're talking about a filling, we're talking about a temporary crown, we're talking about a temporary filling, temporary pontic glue to the tooth next door, whatever it is to get them out of the chair so they're happy. Or even nerve extirpation, taking a nerve out if they're in pain. I would do the minimal work at no charge, and then I will tell the patient, look, for the definitive work, I will need to get approval from management first. And this probably will get back to you within a day or two maximum. Give us 1 or 2 days to review all your documents, and we'll get back to you. And now it's not your problem 100%. Now you can write a small report. If you don't have a report system in the practice, like a warranty form, write a report to the owner or the management. Hey, I saw this patient at this time. Patient has this treatment done last year with dentist X. This treatment is failing. Nothing is clear in the notes about it. Patient is asking under warranty, please let me know what to do. And let the practice deal with that. So, and I performed this emergency work. I didn't charge the patient. Can I be compensated for this work as well? That's the system I would recommend. Again, you don't have to promise them. Don't make them unhappy, say there's no warranty. If you're unsure, the notes are not clear, just do the minimal work, get them out of the chair, they're happy, and tell them I need to get approval from management. I'll get back to you in 2 days. And keep it very formal. Again, it's part of life, it's part of working in a large practice. You'll be dealing with it. And the more you accept, you will see this every now and then. It shouldn't be very common. Then you will feel more relaxed about it because you know there's a system to follow. If you find this information valuable, please make sure you like and share it with your friends, and please subscribe to the channel so I can provide you with more content that hopefully add value to you and your practice. Thank you very much.